Hello, Brilliant Health community. This is Dr. Wilder coming to you middle of November. Where has this year gone? Why is it not over yet? Unfortunately, again, we are in a place of exponential COVID growth. We blew past 10 million cases with record daily cases now exceeding 160,000 and over 60,000 hospitalized, which is straining many hospital systems. Unfortunately, El Paso is at capacity. They're flying out patients and expanding with portable morgues. That is a chilling thing to see in any city. Milwaukee had a 5-fold increase in hospitalizations in just 2 weeks, and Chicago is also setting records, along with South Dakota, which is one of our most mask-resistant states, now with an astounding 50% test positivity rate. The World Health Organization designates anything over 5% as being dangerous situation. So disease is so widespread nationwide that we don't have staff to deploy to high-need locations as we were able to do in the spring. And beds, supplies, and medication shortages are one issue, but staffing is another. Caring for COVID cases in the hospital, which I call the war zone, is mentally and physically grueling. And high risk, and many high-risk healthcare workers are burning out or bailing out. So healthcare workers make up a tiny fraction of the population, but a whopping 6% of COVID hospitalizations. So I beg you to think of their sacrifice the next time someone invites you to a bar, a party, or other high-risk activity. Honestly, I'm feeling like a broken record. COVID-19 spreads like wildfires. And just because you don't see it in your neighborhood does not mean that people are not walking around infectious and not knowing it. Weeks after exposures, we see escalation in hospitalizations. So that tells us this is not due to testing alone. This is real disease. And then weeks after that, we will see increased mortality, now projected to hit about 300,000 dead by the end of this year. Honestly, this should not be happening. And it's not about politics, this is about lives. In my opinion, health policy should be dictated by qualified experts in the field. Relying on herd immunity, denial, magical thinking, or personal responsibility is clearly not working. Our individual liberties have boundaries when they risk others' lives and liberty. So, and it's also, as I've said before, using COVID testing alone as a strategy to prevent infections is about as useful as doing pregnancy testing to prevent pregnancy. We are able to prevent lockdowns, severe economic consequences, and overwhelmed hospital systems if we all exercise common sense preventive measures by behaving as if we are infected. Wear a mask, keep ourselves spaced from each other, keep gatherings small. If you socialize, do it thoughtfully, ideally outdoors, where in Arizona we're able to do that, maybe with heaters. Again, spaced and small. Regardless of anything you've read or heard, even from well-meaning physicians, masks are effective when combined with distancing and hand hygiene. Someone recently posted online, well, if the governor won't wear a mask, why should I? To which one of my daughters promptly responded, be better than the governor. That's wisdom from the mouths of babes. At least 120 studies are quite conclusive that masks reduce the spread to others and reduce the viral dose to us when we're exposed. So if we all masked up for just a few weeks, we could save 130,000 American lives by February. And honestly, I don't think that should be so difficult. So I thank you for being role models in our community, because united we stand, divided we fall. Now, I want to get on to some good news, and there is some exciting news. As Dr. Fauci said, the cavalry is coming. The FDA gave emergency auth to bamlanivimab. Let's say that 3 times fast. A monoclonal antibody for those 12 and up with severe COVID at high risk of hospitalization or complications. It is not indicated for someone who's already hospitalized or needing oxygen. It actually can make those outcomes worse for those patients, and it does not prevent COVID mortality, at least in the data we have so far. It is not clinically available yet locally, although we are working on trying to make sure we know where it's available for our patients. It is flu season, and get vaccinated. There was an encouraging study that showed that the flu vaccine and frankly any vaccine helps boost immune response to COVID. So please get your flu vaccine, especially if you or anyone you care about or are close to are at high risk. LifeScape has already ordered combination COVID and influenza rapid tests, so we will be able to check for both viruses with a single swab, hopefully quite soon. Now to the hopeful prospect of COVID vaccines. I want to put a big shout out thank you to Dr. McMillan and our nurse practitioner Val Ziski for updating our team on all the COVID-19 vaccine trials in Maricopa County's health department plan. You've probably all heard the press release showing about 90% efficacy of the Pfizer-BioNTech mRNA vaccine. Now, understand this is based on just 90 cases of disease out of 44,000 people in the study. So it's encouraging, but still extremely preliminary data and too soon to make definitive conclusions, but so far so good. My husband is helping me a little bit this morning with questions that may be coming up. So I want to talk a little bit about maybe some of the myths or questions that people may have about the COVID vaccine. So Bob, you want to help me?
If I get vaccinated and can I get rid of the mask, attend gatherings, and travel freely?
So I think this is one of the biggest myths that a lot of people have, is that vaccines are going to be the magic bullet that allows us to get out of this mess. All currently leading vaccines produce what's called an Igg response, which is similar to that with people who have COVID naturally. But the vaccines do not develop an IgA response. And this means that the lower respiratory tract is protected, so you're not likely to get COVID pneumonia, but your upper respiratory tract, your mouth and nose, and your digestive tract, which we know COVID also attaches to, is not protected. So potentially that means you could still get COVID without symptoms, and you potentially could spread it. So it's not clear yet whether that's the case in humans. So regardless of vaccination, we are still going to be recommending masks, distancing, and caution until this pandemic is under widespread control. That means, an R naught or RT less than 1, which if you look at the RT.live website, it's not pretty for the United States right now. Virtually every state except for Mississippi, not sure what they're doing there, is in an escalation, or case positivity rates less than 5%. Next question.
Is a person safe to be around after they have had COVID and then test negative?
First of all, we don't recommend retesting after a bout of COVID. It's not clinically useful. It doesn't help us. Once somebody has had 10 days from the onset of COVID symptoms or from a positive test, they are considered non-infectious. So yes, they are safe to be around, but I would not ever recommend relaxing things like masking, distancing, hand washing, all the normal hygiene. We tell every COVID case that we have no idea how strong or lasting their immune response might be.
They've asked that the question be repeated. So that was just asking whether it is safe to be out and around other people after one has had COVID and they've then tested negative.
Right. Again, having had COVID or having had a COVID vaccine does not mean you are completely immune or unable to spread a virus. So we still will recommend masking, hand washing, and general distancing precautions.
When do you expect the vaccines to become available to the general public?
So this is, of course, everybody's big question. That the initial phase of vaccination, hopefully within the next month, will only be available to very high-risk healthcare workers, those in hospitals, long-term care, outpatient clinics with direct exposure to COVID cases, home health, emergency responders, or those exposed to infectious materials, such as people cleaning in a hospital situation. The first vaccines that look like they'll be approved are the Pfizer and the Moderna vaccines, mRNA vaccines, which require very specialized ultra-cold storage. That's not available in most clinics or even hospitals. So they will be distributed through specific vaccination pods, of which Honor Health appears to be the closest pod for our patients. In January, hopefully, we'll go to phase 1B, which is going to target essential workers based on exposure risks. So things like teachers, child care workers, others in law enforcement, corrections facilities, transportation, food and beverage, agriculture, and senior citizens, those age 65 and up, and those with high-risk health conditions. I know that Walgreens and CVS are already partnering with the health department to vaccinate seniors and high-risk individuals and those living in senior living or nursing facilities. Now, widespread vaccination for the entire population is going to probably be mid-2021, depending on how quickly we get these other groups covered and vaccines deployed. Children are just beginning to be included in the COVID vaccines trials, so it's going to take longer to determine effectiveness, as most pediatric cases are asymptomatic. So the only way to tell a vaccine's effective is to tell that it prevents infections. Well, if you don't see the infections, it's going to be harder to pick up. So it's going to be a process, and it will be a fair process. And we will follow through. We've already enrolled with the health department to be a vaccine provider. We will not be offering those first vaccines.
How many vaccines will be required for an individual to take?
So most of the vaccines look to be at least a 2-dose series. A few of them may be a single dose, the Johnson & Johnson in particular. But it's still being worked out, and it may be different for different cases. We know people who are immune suppressed or who are elderly may not respond as well to one vaccine or another. So that all remains to be seen.
What side effects do you anticipate from the different vaccines?
Again, this is going to be learned as we go to a certain extent, and the optimal doses are still being figured out. But the Pfizer and the Moderna RNA vaccines look to be the best tolerated, although we have never had RNA vaccines before, so the long-term consequences are completely unknown. But typically with most of these vaccines, we're going to see injection site reactions, headache, fatigue, maybe flu-like symptoms, or fever. Again, long-term side effects, we will not know for many years.
Since you're discussing long-term, can you tell me something about the long-term symptoms that we know or might not know regarding COVID?
Right. So many of you may have heard about what are being called long-haul symptoms. And, like many viruses, herpes, for example, chickenpox, Lyme, etc. There are a number of different infections that have consequences that we see progress over time. And COVID is among those viruses. Probably the most common things that we see are recurring fever, or fatigue, profound fatigue, or people who go through bouts of flu-like illness recurrently, not unlike we see some people with the mono EBV virus. We've had, there are potential cardiac consequences, blood clots, heart attacks, strokes can be late COVID complications, abrupt neurologic things, hearing loss, cognitive changes, brain fog. etc. So again, this bug is writing its own textbook.
So in discussing those long-term symptoms, do they apply only to people who are symptomatic for COVID now, or could it apply also to people who are asymptomatic?
It appears that the long haul consequences can happen whether you had a mild case or an asymptomatic case or a symptomatic case. So just because you've gone through the disease and had an easy time of it does not mean that you're completely out of the woods.
Would you yourself take the vaccine or recommend a vaccine to your patients?
So I don't think there's enough information for my decision. I think a lot of people are jumping one way or the other prematurely. But to me, it depends on the study results. So we have to think about several things to know if a vaccine is a good idea for a specific individual. Number one is what is that vaccine's effectiveness in patients just like me? Did they study people my age, and what was the antibody response? What was the disease risk reduction in people who looked just like me, my age, my weight, my ethnicity, my comorbid conditions, etc.? Two, is my immune system optimized? If you are an inflammatory mess or you have high-risk conditions like obesity or blood sugar problems or hypertension, kidney disease, heart disease, I encourage you to work with us, or at least work with Dana, our nutritionist, intensively to get your system optimized so vaccines have a chance of working. We know that diabetics, for example, have a much lower immune response to flu vaccines and a much higher risk of dying of COVID if they confront it. If we get those sugars under control, you're going to have a much better immune response and a much better chance of beating this virus if you come across it. And you also have a lower chance of having an aggressive inflammatory response to the disease or the vaccine. Two, I think you have to weigh your risk. How at risk am I? Those of us working in medicine have a different risk, or working in a child care center or as a teacher, than somebody who can really stay at home and stay fairly safe and isolated. Can I afford to wait until more information is available? And we have a lot more data. Are there better vaccines on the horizon? I think there are some exciting vaccines coming along, even those out of the country. China's vaccine looks very promising. And do we know enough about the short and long-term consequences of the vaccine versus the natural disease? Right now, I think the natural disease is scary enough that I'm going to weigh on the side of probably encouraging vaccination, but we still have a lot more to know. And then the other question that's going to come up is, should I be vaccinated if I've already had the infection? And I'm not entirely sure, but I'd want to look at inflammatory markers and where you are overall health-wise, and then again, see data on how lasting is this immunity. We're still learning that as we go along.
Do you anticipate having any of these vaccines available at LifeScape?
As I said, we don't have the ultra cold storage capability, nor do we have the volume of patients to support the minimum order being required for these initial mRNA vaccines. So those are going to be done at vaccine-specific sites. But we have already jumped through the hoops of registering to offer COVID vaccines, so hope to be able to provide some of the ones that come on later down the pike, such as the AstraZeneca, Oxford, or the Johnson & Johnson vaccines when they become available, which should be early next year.
I've heard mention in the press of T cells. Can you tell me what T cells are and how they relate to COVID?
So T cells are another aspect of the immune response. As we look at the vaccines, we're looking mostly at B cell response, which B cells are what produce the antibodies that fight off infections. T cells are things like our natural killer cells and helper cells, another branch of our immune system that also responds to infection. We're just now getting the capability to actually measure some T cell functions in COVID and see what kind of responses the disease or the vaccines engender. So we're going to learn a lot more about that as time goes on. And again, all the things we talk about in terms of your overall health, your blood sugar dramatically affects T cell function. The quality of your sleep dramatically affects T cell function. And the quality of your exercise also has a huge role. So, all these things that we focus on every day are the things that are going to assure you have the best immune system possible.
You had mentioned the monoclonal antibody treatment. Is that something that I should get? And if so, how do I go about getting it?
I wish we knew. It seems you have to be on the White House staff to be able to get it right now. We've been putting out feelers locally and in the physician community, and so far it is not available clinically, but we are doing our best to find it. It's only recommended for very specific patients who have a significant high-risk status, and only before hospitalization. Again, once you're hospitalized or if you need oxygen, it does not look to be helpful, and in fact could be harmful. So I think once you're in that inflammatory overdrive state, adding more antibodies is not the answers, but I'm hoping we will have them available very soon.
Do you have any tips for patients who may have family coming in for Thanksgiving or planning to do Thanksgiving entertaining?
Right. So, yeah, with this escalation happening right before the holidays, I think we're all struggling. We are all struggling with how do we gather and gather safely. And one of my daughters reminded me this morning that the very first Thanksgiving supper involved some pilgrims coming to the table with some very deadly diseases for the Indians. We do not want to repeat that process, but so again, a lot of you are coming to us very thoughtful about, bringing family out, having testing done to at least be somewhat reassuring. Again, the testing is not perfect. Where people quarantine for a little while, we know that air travel now is quite safe, provided masking is adhered to on the plane. And that you're following good hygiene throughout the travel experience. And then I think you can have small gatherings. I'd keep them less than 10 people. If you can do it outdoors with heaters and things like that, all the better. That's a safer situation. Otherwise, if indoors, ventilate as much as possible, keep spaced as much as possible, especially if you have high-risk family members, which honestly, given this is America, I think we all do. So I hope you do that safely. Any other questions before I move on? So this gives me a chance to move on to the healing power of gratitude, because this has been such a challenging year. Today is National Kindness Day, and we are in the month of Thanksgiving and just celebrated Veterans Day. So a lot of positive things. So let's spend a few minutes reflecting on the healing power of gratitude. Many of you heard me say happiness is a verb. Attitude, meaning how we face the rapids when we hit them, is a choice. And gratefulness is the action plan. And this is powerful medicine that I've learned from many, many patients over the decades who've thrived despite enduring hardships and inhumanity that most of us could never imagine. So gratitude is the absolute antidote to every toxic emotion: despair, resentment, rage, envy. It reduces the negative health consequences of depression, anxiety, suicidality, eating disorders, and substance abuse. It's proven to increase empathy and reduce aggression. And couldn't we all use a little bit of that right now? And gratitude is associated with improved immune response and reduced risk of respiratory infections. So again, powerful medicine. And it's not surprising, grateful people are better liked. I mean, who really wants to hang out with a chronic complainer? They are more generous, they are more spiritual, less materialistic, calmer, and tend to have better self-esteem. Those who regularly practice gratitude through prayer, meditation, journaling, or other daily habits are proven to be happier, have stronger relationships, better sleep, and better resilience in the face of hardship. They also practice better self-care, tend to exercise more, have lower blood pressure, and enjoy better health outcomes, including cancer survival or recovery after cardiac events or stroke. Recent data about COVID is showing that about a third of recovered patients are experiencing significant mental health consequences. So again, I think gratitude is powerful medicine in the midst of COVID recovery. So I encourage everyone to create a daily habit of counting blessings, not hassles, practicing random acts of kindness, writing down, praying on, or thinking of just 3 things a day that you're grateful for. Especially when angry at someone, write down all the things you appreciate about that person. And better yet, let them know it. Make a dinner time habit of each person sharing something positive that happened that day, something that made them laugh, touched their heart, or inspired them. Write a note of thanks to someone you appreciate. One of my patients, an extremely successful businessman, recently told me how he made a point to personally thank all the people who've helped him along the way, and I tried to do the same. In college, my senior honorary group created a tradition we called Gratitude Day, where we sold thank you grams to raise money for charity. And on the day we delivered the thank you grams, I will never forget bringing a cheerful lunch lady to tears. She was overwhelmed with receiving hundreds of thank you grams from students. And it always makes me cry. But she got more than anyone else that day, the lunch lady, because she truly embodied the saying that those who bring sunshine into the lives of others cannot keep it from themselves. So these are dark days, but it really doesn't take much to bring that ray of sunshine. So thank you for bringing that sunshine to me every day. Thank you to my family and to our patients, and for sharing our words with people you care about. Stay safe. Enjoy the Thanksgiving holiday. This is a year we know we cannot take our health or our life for granted. Thank you.